sprained my ankle. Should I go see a doctor?
Well, let's talk about it. What's going on, YouTube? It's Dan, it's Ken, it's Dan and Ken PT. And today, we're going to be talking about ankle sprains and when to see a doctor. Ankle injuries are very common, unfortunately. The vast majority, nearly 85% of ankle sprains, are inversion injuries. That's kind of where your foot goes inward, like when you're running and you catch your ankle in a crack or something like that. So Dan's going to talk a little bit about the anatomy of the ankle.
Here's a picture of the ankle joint. You have three bones that make up the ankle joint. You have the talus, the tibia, and the fibula. To rule out if I have to go see the doctor or not, we can follow these Ottawa rules. And Ken's going to go over those right now.
So the Ottawa Rules are 2 rules to rule out a fracture, aka when to go see a doctor or not. If you have any of the following symptoms, I would go see a doctor to rule out a fracture. So the first rule is if you cannot weight bear immediately after the injury, as well as tenderness to your medial or lateral malleolus. The second rule is if you have an inability to weight bear after the injury, and tenderness to your navicular and 5th metatarsal. And I'll go ahead and show you where these landmarks are now. Okay guys, like I said, there's 2 rules of the Ottawa Rules. The first rule is if you have tenderness at the medial malleolus and the lateral malleolus, as well as an inability to weight bear after injury, go see a doctor. This is the medial malleolus, or your tibia bone. And this is your lateral malleolus, or your fibula bone. The other rule states that if you cannot weight bear, as well as tenderness to the navicular, which is right here, or the 5th metatarsal, which is right here, go see a doctor.
So I just hurt myself a few hours ago. What should I do now? The answer is price. P in price stands for protect. So I'm just going to stay away from activities that can cause more pain or injury. I'm going to rest. Just take it easy for the next couple days, not do a whole lot. Ice. Ice is very important. You'll be icing it 20 minutes at least 3 times a day, but no longer than 20 minutes because the effects might be opposite and more adverse. Also, I could do a little bit of compression. Get some gently wrap around my ankle. That's going to help push some swelling and fluid out of the ankle, improve the healing process that way. And then also to elevate while I'm icing, gonna prop my leg up, keep my leg up above my heart while I'm icing. And then also to keep some mobility in my ankle, get the blood flowing, I'm gonna do some gentle range of motion exercises, just pumping the ankle up and down.
Just back and forth,
Back and forth, all day, every day, for the next couple weeks.
And guys, don't be alarmed with some redness or swelling. You are in the inflammation stage, most likely. That's a normal stage of healing. It lasts anywhere from, a couple days to a week. So don't be alarmed. Guys, thanks for watching the video. We really appreciate it. Please give a big thumbs up and subscribe down below. If you have questions or suggestions for further videos, please don't hesitate to email us at danandkenpt@gmail.com. And remember,
Live,
laugh,
love.